and you're going to stabilize here where you can feel the shoulder flexor muscles. You are going to apply resistance as far distally without crossing the next joint in the opposite direction. So what I'm doing is I'm trying to push her into extension. So she is holding it. So I want you to hold it there and don't let me push down. The weight of my arm is slight resistance, a little more weight is moderate, and a lot of weight, basically when I kind of move in to get a better leverage, would be not heavyweight, slight, moderate, and not severe. What's that word? Min-max. Okay.
Yeah.
All right, so hold there. Ready? One, hold, hold, hold. Okay? If I'm doing extension, it's the same hand placement. I'm going to have you bring your arm back behind you like this. My hand is still stabilizing proximally. I'm going to give resistance in the direction of flexion because I'm testing extensor muscles. I can still feel the extensor muscles in the palm of my hand to make sure they're contracting. Okay? Don't let me move your hand forward. Ready? Hold, hold, hold. Okay? If I'm doing abduction, my hand still stays proximal to the shoulder. I'm going to have you bring your arm up like this. I can feel the middle deltoid. I'm still going to go as far distal without crossing the next joint, which is the elbow. And I'm going to try to push her into adduction, a deduction. I'm testing the abductors. All right, hold it. 1, 2, 3. Good. All right. Now, with internal and external rotation, we have kind of the unorthodox method. You can test it like this just because we need it for the practicum. If she goes into external rotation, I'm still stabilizing proximal because that's where the joint action is. But I'm putting a resistance into internal rotation like this. Ready? Hold it. 1, 2, 3. This is harder because she's having to control it. She's having to have some stability here. And then internal rotation would be down and you pull up into external rotation. The alternate way, which is sometimes easier but it's harder to measure range of motion, is to have the elbow by the side. So I want you to bring your hand into internal, touch your belly. Well, it's kind of invasive to reach into be able to pull the hand down. So I move my stabilizing hand down to the elbow so that we're not pulling the arm out like this. And I have my hand here at the distal forearm without crossing the next joint, which would be the wrist. Hold it there, don't let me pull your arm out. Good. If she goes into external rotation, I'm still holding at the elbow. I'm still distal without crossing the wrist, and I'm pushing her into internal rotation. So far, so good? Did I get all of them so far? All right, so moving down distally to the elbow. When you test elbow flexion, you're going to have your hand around the upper arm. I tend to fit it so I can at least feel one of the bicep heads, but I can also feel the tricep. So if I want to go ahead and test extension, I can do that at the same time. So I want you to touch your shoulder. All right, now I want you to hold it and don't let me pull your arm out straight. I go as far distally without crossing the next joint. I'm going to pull her into extension. Hold it. Hold. If I wanted to test extensors, I would have her go into extension, but I don't want her to lock her elbow, so just relax right there. I still have my hand in the same place, stabilizing at the upper arm. My resistance is going to go in the direction of flexion. Hold it. 2, 3. Good. As you go down to forearm, we have pronation and supination. You cup the elbow to stabilize it. She starts out in mid-neutral rotation. I want you to go down with your hand palm down. All right, I'm going to pull resistance into supination to test the pronator muscles. I do not cross the carpal bones. I go right, and I always go just a little proximal to the styloprocesses of the ulna and the radius. I make this is called lumbrical grip because it's your lumbricals are engaged when you do this. I tend to go like this, and you guys practice various ways to hold. All right, and don't let me pull your hand palm up, and I'm pulling into supination. Hold. 1, 2, 3. And I'm testing her pronators. Go palm out. I tend to keep my hand still like this. Some people go like this. Don't let me pull your hand palm down. Ready? Hold it. Good. When you go into wrist flexion and extension, I tend to just do pronated forearm to do wrist. You can have her in neutral rotation. This is just functional manual muscle testing. This is not the standardized manual muscle testing that is outlined in your book. So I want you to bring your hand back like this. I'm stabilizing proximally to her wrist. I'm going to give resistance into flexion because I'm testing the extensor muscles at the metacarpals as far distal as I can go without crossing the metacarpal phalangeal joints. So hold it there and don't let me push down. Ready? Great. Now go down with your hand down. I'm going to go as far distal without crossing these metacarpal phalangeal joints. Hold it. Don't make the leg. Good. So when we're testing radial and ulnar deviation, you want the wrist in neutral flexion or extension. I want you to move your hand towards your thumb side. I'm going to just do 1 or 2 fingers in along the second metacarpal. I'm still stabilizing proximal to the joint that's moving, and I'm giving resistance as far distal without